So how to read your skin biopsy or your melanoma biopsy? You get this report like that, melanoma of skin synoptic report. As an oncologist, I immediately go to two things. I go to the Breslow depth. I want to know the depth of the melanoma. It's 5.2 millimeter. That's extremely important. I immediately give it a T4. So anything more than 4 millimeter is a T4. Then I go to the ulceration status. Where is ulceration status? Ulceration right there, it's present. For an ulcerated melanoma, I give it a B, so T4B. If it was not ulcerated, I would give it T4A. Why is that important? For the staging. So T4A melanoma is a stage 2B melanoma. T4B melanoma, on the other hand, is a stage 2C melanoma. And as the stage goes up, of course, it can affect the survival. The other outcomes would be worse. So these are the two most important things I look for in the pathology report when I'm staging a patient. Let's it's so here describing it's a shave biopsy. Macroscopic tumor is present. They're giving you some size. Satellite nodules absent in this case. If there was satellite nodules, that's immediately called stage 3. Again, satellite nodules, even if you don't have involvement of the lymph nodes, that makes you immediately stage 3 melanoma. Then they're describing the melanoma. It's superficial spreading type melanoma. The ulceration is present. Important. You gotta look at the ulceration because it is factored into the staging system. You look at the Breslow depth, 5.2 millimeter. And then here they're talking about the peripheral margin. Of course, it's a shave biopsy, so that's not this, that's not the treatment for melanoma. That's just a biopsy. You gotta have a wide local excision, and because it's deep, you gotta have a sentinel lymph node biopsy as well. And here they tell you that it's a PNX, meaning we have not assessed the lymph nodes. If the lymph nodes were assessed, then they're gonna give you a number such as N1A, N1C, N1B, N2C. They're gonna give you a number regarding the lymph nodes. And as for MX, metastatic disease, it has not been assessed in this pathology report because they only did a biopsy of the skin lesion that turned to be melanoma. So this is how you read your pathology report. Let's go another example, and those examples are available online. This is a melanoma that is excised. This patient underwent excision. It was located on the left shoulder. Dimension of the melanoma is different than the depth. Don't mix dimension and the size of melanoma with the depth of melanoma. 1.8 centimeter, okay, that's the size of it. What I care about is the depth or tumor thickness or Breslow depth. And here it is 10.35 millimeter, okay? And the ulceration is present, that's another thing. So here we are talking about, as we said, anything more than T4, more than 4 millimeter, it's a T4. Because it's ulcerated, we give it a T4B. Peripheral margins, important. We want to make sure that the peripheral margins are negative, but in this case, the deep margins involved. Well, that means it's a surgery, but with a positive margins. So something else needs to happen. I think this patient may need another surgery to just make sure we get a negative margin. So always look at the peripheral margin. It's important to read. Mitotic rate, of course, a melanoma that has a high mitosis, like a melanoma that is low mitotic rate 1 or less, is different than a melanoma that has a high mitotic rate more than 1, and in this case 8. As the mitotic number goes up, of course, the melanoma is more aggressive. Microcellulosis. This is a microcellulosis is present. So immediately, that's a stage 3 melanoma. Okay, that's stage 3 melanoma. So we're talking about T is T4B. T4B, a lot of people mix T4 and 4. They say it's stage 4. It's not stage 4. T4B means this is the tumor. So we stage the tumor first, how deep it goes through the skin and whether it's ulcerated or not. Hence, in this example, it gets T4B. It's more than 4 millimeter. The ulceration is present, and we give it a number T4B. Then we go to the lymph nodes. In this example, although no lymph nodes were involved, let's see here, total of lymph node example. So you see here the lymph node excised. So they have not examined actually the lymph nodes, but because there is a microcellulosis, that's immediately, we call it N2 disease, okay? N2 disease. And that immediately make the melanoma stage 3. And you tell me, like, how do we find out about the staging? How do you know that? Well, we go to these tables. Let me just open this article for you and tell you the name of the... Go to this article, Melanoma Staging, Evidence-Based Changes in the American Joint Committee on Cancer, 8th edition Cancer Staging Manual. That was published in 2017. This is where you can go and find the tables of survival and anything you want regarding the staging. So let's go to some of the figures in this article. There should be a way to go. Here we go, the figures. Okay, let's take this figure, figure 1. Well, we talked about that patient or that example in the pathology report. It's a T4B. I look T4B. This is T4B, okay? This is right there, down. Then here they're saying the number of people enrolled in the study, 5-year and 10-year. So when they followed people with T4B melanoma, and that's melanoma only in the skin, T4B, I mean, they're talking about more than 4 millimeter in depth and ulceration is present. Look at the 5-year overall survival, 82%. Look at the 10-year, 75%. So within 10 years, 25% of the people unfortunately had recurrence, probably had metastatic disease, and they died from their melanoma. So if you look here at the axis, this is a melanoma-specific survival probability. And as you can see here, as the stage of the tumor itself, the T, we go from T1A. As we go up, meaning the melanoma is getting deeper and deeper and deeper in the skin, as you can see here, the survival gets worse. And that's one of the figures, for example. Let's see if there's other figures. There's a lot of figures. Other figure that I like to look at is this figure. Well, not this one, this one. This one is very helpful when you need to know if you have a stage, for example, 3 melanoma and what is exactly the stage of the melanoma. So we go here, for example, let's say in that example we discussed, let me just enlarge this. I'm not able to enlarge it. Yeah, I can here. Okay. We discussed T4B. Look at the last column here, T4B, okay? And let's say N2C, we said, in transit disease. So T4B, meaning a melanoma that's 4 millimeter and more with ulceration, and N2C, and then we come here and we say it's stage 3C. It gave it the number C. So this is a stage 3C melanoma. Let's say a patient had a melanoma that is, you know, T1A, for example. This is a thin melanoma, or T1B melanoma. And they did a sentinel lymph node biopsy, and the sentinel lymph node biopsy showed 1 lymph node involved. Well, we look at it, T1B, N1A, and that makes it A, meaning stage 3A. This is how you can get to the stages, whether stage 3A, 3B, 3C. So in order to get the stage, you need the depth of the melanoma, you need the ulceration, because you need to assign it a number, whether it's a T1A or T1B. T1A, no ulceration. T1B, you know, with ulceration. Is it T4A, 4 millimeter without ulceration? T4B is a 4 millimeter with ulceration. So once you get the T, you need the N's, and the N's you get it from the pathology report if there is a sentinel lymph node biopsy done, or if microsatellite status, if they say it's present, then you know you're dealing with N disease. And usually in the pathology report, they will write for you the N, is it N1A or N1B or N1C? And then you come to this figure, and then immediately you figure it out, you know, what kind of stage it is, stage 3A, 3B, 3C, 3D. You gotta be careful about also obtaining a PET CT scan, because, you know, you wanna make sure that we're not having M1. When we talk about M1, meaning there is metastatic disease. M0, there is no metastatic disease. So before you assign a stage 3, you wanna just make sure you got a PET CT scan and, you know, you don't have evidence of metastatic disease. Let's see other figure. This figure, for example, is... There is one about the survival of stage 3 melanoma. That's it. No,